I'm Dr. Saul. Did you know that sadly, colorectal cancer is the third most common cancer and the second most common cause of cancer-related deaths, both Canadian men and women, as reported by the National Cancer Institute of Canada? The good news is that with a little knowledge and understanding, this disease is preventable, and the reason why I'm doing this video. The majority of colorectal cancers arise from cells that line the inner surface of the colon or rectum, which together form the large intestine. That's the final segment of the digestive system responsible for processing food, absorbing nutrients, and eliminating waste from your body. Colorectal cancers develop from benign growths called adenomatous polyps that form on the colon lining. Over time, these polyps can grow in size and number, increasing the likelihood of cancer. Fortunately, removal of these polyps through a colonoscopy can prevent the development of colorectal cancer. The procedure is usually done under sedation with a quick and pain-free recovery. The removed polyps are then analyzed for any malignant properties. Early detection of colorectal cancer is crucial for successful treatment, and up to 90% of cases can be prevented through timely screening. However, nearly half of colorectal cancer diagnoses are made at a late stage, according to Colon Cancer Canada. This is likely because there is still a large segment of the population in Canada and Ontario that have not had up-to-date screening. Unfortunately, we are also seeing an increase in colorectal cancers in younger patients, including people in their 30s and 40s. Did you know that over 423 Canadians on average are diagnosed with colon cancer every week? 175 Canadians die of this disease every week. 1 in 4 men is expected to develop colorectal cancer during his lifetime, and 1 in 27 will die of it. In the same time, 1 in 15 women is expected to develop colorectal cancer during her lifetime, and 1 in 31 will die of it. The fact is that anyone 50 and up should be screened, regardless of family history, even if you have no symptoms. So what are some signs and symptoms of colorectal problems? Blood on or in the stool, either bright red or dark in color. Persistent change in normal bowel habits such as diarrhea, constipation, or both for no apparent reason. Persistent abdominal pain or cramps. Stools that are narrower than usual. General stomach discomfort. Bloating. Unexpected weight loss. Fullness in the rectum. And a frequently recurring need to evacuate your bowels. So why is colorectal screening so important? Colonoscopy is a screening test to find and remove polyps, to prevent colon cancer, and to identify cancer as early as possible if it is present. A colonoscopy is a medical procedure that allows your doctor to visually examine the lining of your large intestine from the inside. We use a long, flexible instrument called a colonoscope. This device, about as thick around as a finger, has a video camera on its tip and sends images to a video monitor where we can observe its path from your rectum to the deepest part of your colon. In reality, it's that simple and completely pain-free. So should you get screened? Sadly, I've seen too many members of my own family, including my own mother, who are no longer around because they didn't get screened. With just a little knowledge, this disease is preventable. There is no single cause for developing colorectal cancer, but there are some people who are considered to be at higher risk than the general population. This includes people with a family history of colorectal cancer. If you have a first-degree relative, such as a parent or a sibling, who has had colorectal cancer, you should get tested 10 years before his or her age of diagnosis. For example, if this family member was diagnosed at 48, you should be tested when you're 38. Ongoing regular screening with a colonoscopy is usually recommended for those who have had polyps previously removed, those who have had a colon cancer, and patients with inflammatory bowel disease, such as ulcerative colitis and Crohn's disease. The reality is that everyone who is 50 years and over should get screened. And the truth is, if you're at higher risk, you should talk to your doctor about being screened as soon as possible. I hope that this brief explanation was informative for you. And if you have any questions, please know that my team and I are here for you every step of the way. We all look forward to making sure you are in the very best of health and that you are in great hands here at Oakville North Endoscopy Clinic. Please take care of yourself.